Welcome everyone. In this video, we're talking about treating ADHD without medication. If you want to learn how to improve your mental health, go ahead and subscribe to this channel. I'm Dr. Nic Bhopal, a physician specializing in integrative psychiatry and sleep medicine, and I'm the founder of Pacific Integrative Psychiatry, which is an online mental health practice in California. So today I'm delighted to be joined by Nic McLaughlin. Nic is an ADHD coach. He was personally diagnosed with ADHD at the age of 8. He's mastered strategies to overcome his ADHD struggles without medication. And over the past 18 years, he's established a career coaching ADHD entrepreneurs, celebrities, and 8-figure business owners. He's been featured on major platforms like Thrillist, Medium, and NBC. And he helps people who struggle to follow through, focus, and get organized to master their ADHD in just 90 days without therapy or medication. Welcome, Nic.
Thank you so much. That made me feel so important. Thank you for that.
I'm so excited that you're joining me today because this is such an important topic. And, I see a lot of patients in my practice who struggle with focus and ADHD symptoms or even ADHD-like symptoms. So I'm really excited to hear more from you about, how you help people with these issues.
Oh, absolutely. Absolutely.
Yeah. So I'd love to hear more just about yourself and why you became an ADHD coach.
Okay, so my story is when I was 8, I was diagnosed with ADHD, inattentive, which basically means, there's 2 types. There's hyperactive and inattentive. There's also a mix, but the main 2 types are hyperactive is where you're jumping off the walls, you talk a lot, there's a lot of movement, it's hard for your brain to slow down. And inattentive is where you can't really tell someone has it. But you struggle with like procrastination, like you don't follow through as much. There's distractions everywhere. You're not good with time at all. And I had so much of that in school, and I was having a really hard time, and I was going through depression actually. So what I would do to feel like I was making a difference was I would reach out to other people who were on social media that said they were depressed, and I would just reach out and say, hey, are you okay? And we just connect and have conversations. And I just really liked how that would turn from me feeling like I didn't know anything, like I didn't have any value to give, because I was already struggling with so much, to being able to help someone change their life just from being a good listener. And I would constantly do that over and over and over for new people. And then their friends would hit me up and their families would hit me up and they'd say, what did you do? They're so different. They're starting to smile now. They're starting to reach their goals really fast. They're starting to do this and that and this and that. And I'm like, I didn't do anything. I don't know. So I kept doing that for 14 years voluntarily, never charged a penny. Strangers would hit me up all the time. And I would eventually find a pattern of the same things that would keep happening for people that were overwhelmed, people that struggle with their ADHD, people that were going through tough times. And I just kind of figured it out. And I realized maybe there's a way I can actually just go all in on this and just support people for a living. I don't want to keep working 5 different freelance jobs. So I became a coach. Now I've been doing it for 18 years and it's been my huge passion. I love it more than anything. And it's really nice to connect with people who I understand and that know that I will understand them.
It's amazing. And it's really powerful when you've had those experiences yourself, and then you're able to help other people who are experiencing the same kinds of things. And especially when you feel like you're not doing anything, like you were saying, like, I don't know, I just talked to them and they somehow got better. Like, that's really a sign that you're doing what you're meant to be doing. So that's an amazing story.
I feel the same way. I'm really grateful about that. It's nice to not feel like I have to force anything.
Absolutely. And so I think ADHD is one of these things that is maybe a little bit misunderstood. The term is thrown around a lot. People will say things like, oh, I'm so ADD, or, I'm so ADHD, or so but it's an actual condition with very specific signs and symptoms. So could you just share more about what exactly ADHD is?
Yeah, so ADHD is still not as understood as it should be. It's only been studied for very little time. It was originally pointed out in the 80s, and it was just like, you have ADHD, that's it. you know, and it's been changing a lot. And even nowadays, you'll see a lot of the symptoms come actually not just from having ADHD, medically diagnosed, but from other things like traumatic experiences. They have similar symptoms. And there are also things like taking into consideration that we live in a time where technology is right in our hand. It's not just a phone. This is a calculator, a phone. It's the internet. It's the GPS. It's the food service. You can get food magically delivered to you. It's like in the palm of our hands, and it's so hard not to take all of these things into consideration. But yeah, there's a lot. I get a lot of people that come to me who say that they think they have ADHD. They're not sure. I can't diagnose, so I send them over to people to get diagnosed. But at the same time, it comes down to the symptoms of executive function, like procrastination and disorganization, time mismanagement, emotional overwhelm, and distractions, So if you're struggling to follow through with things and you just keep starting new projects, or if you are just so attached to your phone and you just, for some reason, you will spend hours on this thing, a lot of that stuff happens because our dopamine it controls our lives. And I feel like nowadays a lot more people can relate to that, whether they have ADHD or not.
Definitely. And wow, there's so much great information that you just shared. And
that's good news.
Yeah, no, absolutely. And I think just reminding people that we are surrounded by distractions 24/7. It's kind of unprecedented. How many the human brain has not evolved to manage that many distractions all at once, right? So that's why so many of us struggle with focus and executive function, and even having clarity and perspective on things, because we're having to make decisions all the time. So I think that's a really important point that you just raised there. And I really am a fan of your blog. I think you have some great articles on there. And one of the things that I love that you talk about is that ADHD is normal. Even though it is a clinical diagnosis, it's not it is normal to have it. It's just a different way of being. So could you speak to that a little bit and what you mean by that?
Yeah. So one of my favorite things to talk about with people when I hop on a call with them is, they'll come to me and they'll say, I feel like my family and my friends have always told me I'm lazy or I'm dumb. My teachers, my bosses, I don't do things the right way, and I don't fit in at work. I don't fit in at school. I don't fit in my own family. I've literally been in every single one of those situations multiple times. And it's crazy how you could feel like at a job, you're like the lowest one there. You don't feel like you belong there and you don't do anything right. But at the same time, you have leadership qualities. You're a risk taker. You can empathize with people. You truly care about problem solving, and you can pick up skills and hyper focus like crazy when you're really into something. But that stuff's just not seen. So the point is that you are actually very normal. If you have ADHD, there's nothing wrong with you. There's nothing that needs to be fixed about you. You're just like anyone else that needs to have a right strategy to help them with the way that you work in your life. And it's not very talked about. A lot of people don't know because they expect what they see. And the majority of the world is neurotypical, and you're a neurodiverse mind. So you're going to think differently. So think of it like you are an introvert in an extroverted world, or you are left-handed in a right-handed world. Nothing wrong with you at all, but you have to have a different strategy, especially since there's not as many of us as there are of them. So we have to find the right strategies to perform at our best in the world and understand how we work.
So that's really helpful. Just knowing that, there are ways to manage in a non-ADHD friendly society, because our world, like you said, is just not set up for people with ADHD, like just the way that school is set up and that work is set up. It's just
Oh
not
man,
easy.
school is really hard,
Right.
and it's hard on the parents. It's really hard on the parents because they don't know what to do, and they just do their best.
Yeah, absolutely. And before we jump into some of the strategies that you sort of implement in your coaching business, I also wanted to just point out another thing that you talk about on your blog, which I think is really important for people to know, is that there are other conditions that can look like ADHD. Like you've talked about nutritional deficiencies, like B and D vitamin B12, vitamin D deficiencies, trauma, or just general issues with focus that we were talking about before with all the distractions. So would you mind just sharing a little bit more about that? Like, what are some of the other conditions that might look like ADHD, but don't actually fall into that category?
Yeah, it's really hard to tell because like I was saying before, a lot of therapists even have a difficult time kind of figuring it out, because we just know so little about it. But it can be, at a certain age, I think it was around like anywhere from 8 to 12, somewhere in there. Don't quote me on that. If you had these ADHD symptoms before that, you're more likely to have actual ADHD. But when you take a test, it helps you understand more. And I know that a lot of people just think I struggle with these things, so I must have ADHD, but I would ask a powerful question in there. And that is, what do you want to get out of knowing that you have ADHD? Because when I work with clients, sometimes they'll have this identity in their mind of I have ADHD, therefore I can't do this. And a lot of times we will work and I'll show them like, listen, I've been there. I know how you feel. And a lot of the struggles comes from getting past those walls as well. Like you create a lot of your walls, you'll see. But at the same time, people with ADHD have a way that works best for them. And that's what you got to do is find out what works best for you. So see what diet works best for you. Talk to your doctors, always talk to professionals, but at the same time, also know what's best for you. Get really clear. And the biggest thing that I do teach, and I'll go more into this a little bit later, is being intentional, being as intentional as possible and asking really, really powerful questions. And if you can do that, you don't need to have all the answers. If you could just ask yourself, get used to asking yourself questions when you don't know what to do, that could be enough to help bring you to 10 different options that you didn't have before. So that's what I would say for that.
That's really powerful. And just the idea that, there are all these different things that you can do. And, one thing we work with people in my practice is the nutrition piece. Because, diet and nutrition has such a big impact on brain health and our mood and our ability to focus and all of that. So I think it's great that you bring that in. And so this is a great segue to talk about how people with ADHD can focus without medication. Because, there's kind of this notion that, well, ADHD treatment means you have to take Adderall or Ritalin or something like that. But there's lots of other things that people can do. And that's really, what you specialize in. So can you tell us more about that?
Yeah. So, I like to tell people, like, if you feel genuinely like it would support you to have medication, great. All for you, go and do it, and I highly suggest always talking to a therapist. It's wonderful. Talk to experts. You can only get better understanding, and that's what you want. But at the same time, for me, I was put on different drugs when I was a kid, and it was very difficult for me. Mainly because my parents were also divorcing at the time that I was diagnosed. And so I don't personally even know if I have ADHD because of trauma, because it happened around that time, or because I actually have ADHD and runs in the family. Yeah. So basically medication is something where, if it works for you, great, then do it, but the problem is I see people jumping all the time to, I have ADHD, I think I have ADHD, therefore I need medication. And I would say first, think for yourself and see what works best for you. Because when I was a kid, I got diagnosed with ADHD around the same time my parents were divorcing. And that made it really difficult because when I combined taking medication that was changing my personality, making me more focused, but making me a little bit more numb to my personality a bit. it made me feel also at the same time with my parents divorcing that I didn't matter, that my personality didn't matter so much that I wasn't really wanted. And I took it very hard. So if you're going to, try medication, also, I would really highly suggest asking the intentional questions of, am I going through anything else right now too? Like, would this affect that? So just like I said, being intentional. But diet is huge. You can change so much in your life with just the right diet. Anything that you talk about, you're brilliant at what you talk about. And like I could not put enough of your content into supporting my clients and just giving to them. So diet, understanding that, being intentional. So yeah, medication can be helpful, but I believe that strategy can help absolutely anyone, no matter who you are, no matter what you're going through. Medication or not, strategy will help somehow.
Absolutely. And one of the other things that you say that I think will really resonate with people is that therapy and meds are not the only solutions. They're not the only strategies, because again, there's nothing to fix.
Yeah,
you just need to learn.
Yeah. You're not broken.
Right.
I was told that for so much of my life, that you have to be, you need to be fixed. You need to be just like all of us, be like us, but it's not true. Like you don't, it's just because people don't understand how your brain works doesn't mean that you're broken. You're not, you're different. It's like, you're just a different kind of tool in the toolbox, and it's not different.
Yes, you are not broken. There is nothing to fix. And, there are tools and strategies that people can learn so that they can function at their best. And it's just, this idea that people, need to fix themselves. That is what leads to depression and anxiety. That's what leads to low self-esteem and low confidence. And it becomes a self-fulfilling prophecy, because then you develop all these limiting beliefs because of it.
I would highly suggest, and I spent so much of my time going through like motivational stuff and like those programs you go to, that like the Tony Robbins ones. I didn't go to Tony Robbins one, but there's a lot out there, and self-improvement seminars. And what I really learned is there's a story that you have created about yourself, and you can convince yourself of a story that doesn't actually exist because of something that you made up. So sometimes with my own ADHD in the past, or with my clients, they'll say, I wish I could do this. I wish I could have the job of my dreams. I wish I could be better at time, but I'm just not that person. And we'll go through it, and it's like, you can. That's just a belief you wrote about yourself and your own story in your mind. And they'll overcome it literally in a day, just because they never had that thought before, where it's like, I am the writer. I have the pen in my hand for my story. So that's an empowering thought, to realize that it's not finite. You don't have to believe the story you've written. You can write a new story.
That is so powerful. And I hope anyone who's listening, who's struggling with symptoms, really, internalizes that. And so let's talk about some specific strategies.
Sure.
One of the things that a lot of my patients struggle with is organization. They've tried the planners and the notebooks and apps and, all these different tools to try to stay organized. So what are some of your tips around that?
So organization you have to, no matter what you do, get really intentional. So I'll tell you my strategy. My main core strategy is I have, first aid kits, like when you pull them out, when you have a physical pain, when there's something you need to work on in there. So I made something called a task aid kit, which is just basically saying AID stands for something, which is accountability, intention, and doability. If you can apply those three things to any task that you have, you'll be able to overcome it. So have accountability in everything you do somehow, even if it's for yourself. Have a strong intention, be very intentional, and make things just doable. You don't have to finish everything up front. off the bat. I know it's a lot. I know that we really want to finish things and we'll be perfectionists about it. And then we'll get burnt out completely and just push it to the side under the rug and be like, that's not that big pile under the rug is just a new decoration now. Put a lamp on it. But start small. Always make things doable. That is so huge. And let go of expectations, because it's better to be consistent than perfect. If you can just do one little thing, even you got to pick up one sock, put it in the laundry, that's better than cleaning a whole corner, because at least you're going to be consistent and you'll have finished within a month. Whereas you do like half work up front and then you completely quit for a year, I mean, that's a messy corner, but that's what I would say.
That's fantastic. So that's your task aid kit. So I love that.
Yeah.
So accountability, intention, and doability. And so it seems like the idea there is to make it small, so that it can be consistent and sustainable. So it's not something you're just going to, drop off because it's too overwhelming.
Yeah. And if you'll notice, all of these things, what they have in common is there is no reason to guilt trip yourself. They all take that away. They have a guilt-free card in each of them. You're not setting goals and then making your life a checklist. You're saying, I'm setting an intention, and if I don't do it, I understand. But, I'm also making things doable. I'm having someone hold me accountable. If you can combine all three of those things, there's no reason that you can't reach any task or goal that you want.
And you mentioned perfectionism, and you talk about kind of the four procrastination personality types.
Yeah.
The perfectionism or perfectionist, the self-deprecator, the busybody, and then the shiny object snatcher. So, I love frameworks. So I love how you kind of broke that down. So what tips do you have for people who struggle with procrastination?
So many. That was my big one. That was me. I would start a million different projects. I get so excited about the parts I know, and then I would not know something and I'd get frustrated or feel like there's no dopamine there whatsoever. And I'd start a whole new project in what I already knew. And I do that over and over and over. So, but what finally got me out of that was really focusing on just, like I said, I'm going to keep saying it, intention. You got to be intentional. Ask yourself powerful questions. The more questions you ask yourself about what you're doing and why you're doing it and what you're looking to get out of it, yada, yada. It's like the more you're going to understand why you're doing what you're doing. And I would do that, but you also got to mix it with accountability and doability. Make things doable. If you're going to run into things being too hard at times. So make it more doable. Have someone hold you accountable. Have your friends be there for you, your family. And even just saying things out loud makes a huge difference. But your why also has to be powerful. Your why has to be really powerful. You have to know why you want what you want. So much of my life was chasing what I thought I wanted, but not what I needed. So, and you can find your why really easily by asking yourself, who do I have to be in this life? Like, what is needed of me? How can I be what is needed? What are my skills? What are my gifts? What are the things that I really can offer? And then let go of the expectations of what you think it needs to look like. But just keep that in mind. Keep experimenting. If you have ADHD, you will keep experimenting until you find it anyways. But that's what I would do. And just most importantly, do not be hard on yourself. Go easy on yourself. You're not here to be a robot who is perfect. You are supposed to mess up. If you're not messing up, then you're not doing something right. You need to allow yourself to be okay with taking risks, but also being grounded and finding that perfect balance for you.
Absolutely. And that self-compassion piece is so important, because that's going to make things more sustainable over time rather than doing things out of fear or guilt. So yeah. I think your approach is just so powerful, because it's not just about tips and tricks and, how to organize your file folder or what have you. This is really, getting kind of getting deep and really understanding a person's own values and their motivations and what's meaningful to them, and using that as a driving force, to optimize their functioning. So, I think we could keep on going, but I know you have a course coming up, and you have a website. So where can people find out more about you, and can you tell us a bit about your upcoming course?
Sure. I actually just released my course. So it's actually a gamified course. My goal was to make something that people with ADHD would actually want to finish. And it's fast and doable and fun. It's nothing you've ever taken in your life. I call it the fun to done course, and it's getting things done by having fun. It's gamified. You earn points. You actually earn real rewards that you give yourself. The videos are animated. You watch the videos once every 3 days. You get a workbook sent to you, and that workbook is fun. I want to keep this a surprise, but in the beginning, I made it so that you can cut out your own confetti in there, and like you throw it every time you celebrate a win or a lesson or something. It's really crazy fun, and it goes through everything you need to know to get through any task. And it's only 6 weeks. So it's really fun. You can try there's a free trial version. That's 1 day. I call it the 7-minute one change challenge. You can download that. It's really fun. And go to masteradhdnow.com to do that.
Fantastic. And so we'll put all of those links underneath this video. Well, thanks so much again, Nic, for joining me. Such important information for people to hear. And so for anyone who is struggling with ADHD symptoms, or could just use some help with procrastination and organization and just functioning better, you can go to masteradhdnow.com. Thanks for joining me.
Thank you so much for having me on. I really appreciate it. Everything you do is absolutely brilliant. You are so compassionate, and you genuinely care so much about the people that you support. And it's very nice to have that in the world. And I look forward to seeing what else you create. And thank you everyone for listening. I really appreciate you. Feel free to comment anytime.